My name is Zubesh Gadni, Chief Digital Information Officer at NELF. I predominantly look after a thing called digital for the trust. That covers multitude of things. It covers the core infrastructure, clinical systems, and obviously I oversee our core EPR system, electronic patient record called RIO. So firstly, it's different because we are able to integrate remote monitoring tools directly into an EPR system, so the electronic patient record system. There are not many trusts that have been able to do that, firstly. Secondly, the most important thing is that it allows us to see real-time data of early warning scores for patients. So that's another thing that's not available in many sort of virtual wards currently that are out there. And the biggest thing that we've seen that's really helped our staff is that it's so easy to use, so easy to monitor, so easy to see information. And our patients are really saying it's a massive thing for them being able to be looked after at their home rather than have to travel on the bus or a cab or a family car to go into A&E. So yeah, it's been a real success story so far across the organisation for our staff and our patients. The experience with Access Group has been really good, to be honest. The reason why it was good is because we were able to talk quite frankly to our counterparts about where we thought things wouldn't work really well. Secondly, we have a good relationship with them. Been working with a number of people from Access Group for many, many years, so we know a lot of the product development team. So it's been great to have an EPR vendor that's willing to listen and willing to change the past to work in a new way, which you can see in their new sort of rollouts and programs that are going to be achieved over the next couple of years. They're listening to the NHS and developing solutions for the NHS. On the remote monitoring side, we want to expand it so that we're able to develop solutions that our GPs can use as well. So you have a lot of patients that walk through the door, whether they've got a mental health illness, whether they've got asthma, whether they've got early sort of long-term conditions. So we want to expand it further, whereby where a patient comes into primary care practice, they're able to choose a selection of support mechanisms, so you could just plug and play. So rather than come in, they know straight away that you might have something, so they send out this kit, and then we'll have a central team that monitors those patients and then advises the GP. So we're discussing those types of things, and we're also discussing the environmental side with the social care teams to see how we can manage people in their homes that suffer from dementia, etc. So those are the things that we're planning to do in the future. One of the big things that's going to happen over the next couple of years is it's going to be more about community and mental health. So looking after patients in their homes and reducing the footfall going into A&E. So our digital strategy is purely focused on the digital front door, developing tools that allow people to schedule, rebook, do their sort of updates, have a conversation with their consultant, book their appointments, update their history, have access to their history, able to make a decision. So, that is the way forward. To give you an example, I said it in another sort of video. I have older parents, and the future is that my older parents, they're going to obviously get older, and the aim is to make sure that as they get old, that they're getting looked after at home rather than in an A&E, and that is the future. I believe in the next 5-10 years, that's where the main focus is going to be. Look after you in your home. Take your time. Don't come up with a tech solution straight off the bat. Listen to the people who want the solution. Sit down with them and understand the problem first before you decide what to go and get.